Good afternoon, dental internet world. My name is Dr. Vishal Sharma, and I'm once again here with my friend and colleague, Dr. Mike Parchewski. Mike, the stars have aligned. Unfortunately, the Brazilian variant, which is not nearly as exciting as it once was when we were talking about body waxing, is running rampant through Canada, and it's a perfect time to straighten your teeth while we're all entering a summer of lockdown. That is a terrible segue, but it's the best I could come up with. Mike, it's nice to see you.
Well, it's great to see you too, Vishal, and welcome everybody. It's great to have you here for our podcast. I do agree that's a great example. Technically there won't be a lot of beach activities going on right now coming up here, but there'll be a lot of Zoom things going on. So that smile will be a big deal. So I do feel it's you've got the time, and it's now time to get those teeth aligned. And what else you got to do? So I think that's where our very topical conversation for today is hits home nicely. Now, you've been recently teaching a course on Suresmile, and it's an ever growing market that's coming out with the Suresmile, and it's definitely something we've been incorporating over the last couple of years. So tell us now about this program that you're teaching, and what you guys are covering, and what's the course objectives.
Yeah, it's obviously one of Dentsply Sirona's initiatives is to push through Suresmile, which is a fantastic platform and clear aligner therapy alternative to some of the other existing ones in the marketplace. Invisalign's been a big part of your practice and my practice for many years. And, we can both attest to how successful it's been and just the great results that people get out of clear aligner therapy. Better bites, less gum recession, obviously better hygiene. So Suresmile is a welcome addition to that family of clear aligner therapy. And with the courses we're teaching, it's really just another aspect that we can utilize our Primescan for. I know you have a CBCT course coming up in a couple of weeks with Dentsply Sirona, obviously discussing another aspect of their technology. So with the course, we're really just doing a comparison with how Suresmile relates to Invisalign for those who are experienced providers. And for those of you who may not know much about it, Suresmile is an offshoot of a company called Orametrics, which has a long-standing history in orthodontics, Mike. In fact, I think it was 1998. They're the first robotic wire bending company. So their ability to navigate orthodontics is long-standing, and the software has a deep level of complexity to it, probably more so than most practitioners would ever need. But there are some limitations for Invisalign and Align Tech that you and I will be discussing, and Suresmile really targets and addresses all of those. So yeah, it's an interesting course, very preliminary in terms of the orthodontic discussions on it. We're not getting into a lot of the science of ortho, but for those who offer clear aligner therapy like yourself, and I know you're doing some Suresmile, it's, I think, the way of the future for sure.
Now, just before I forget, is if somebody's looking to register for that course, where would they look for that?
Yeah, so Dentsply Sirona Canada, if you go onto their website, they'll have a plethora of courses on there, whether it's the Thrive with a few of our colleagues for Primescan. You have your CBCT course, which will be listed there as well in a couple of weeks. So it'll be listed in that aspect. And then we do some customized training as well. Dentsply Sirona has an initiative where they're doing one-on-one training for people. So lots more information there. And then on our website, Digital Workflow Dentist, we'll have some more information on that in the near future as well.
Yeah, that's a good idea that we get that up to date for the listeners as well to be able to find these courses. Now, one thing we've recently done with our Suresmile is we've added our CBCT information. So now the volume information from the CBCT is now linked to a Suresmile. The benefit here that we have found is that we can look at what the root position is before and after aligner therapy. Now that we can predict that, we can use it to plan our case. For example, for what we've just recently done, our first case using this actually is a quad 2 lateral, a congenitally missing lateral, that the space has closed. And so as we move that canine back into its position so that we can put an implant in the lateral place, it's kind of neat how we can see where the roots are going to end up based on our aligner therapy, so that we can be able to get an implant in there. I just think it's pretty stunning that you can have that part of your planning. Now, on your regular cases or on other cases that you've worked with, how do you incorporate that? What's your experience with it? Again, this was my first case with it. I know you've done a lot more with it, but or what do you teach on this whole concept?
Yeah, it's a good question. Well, you've got the Cbct, and that, as well as the Osseous from Dentsply Sirona, are compatible with Suresmile. So you scan with the Primescan in our case. We import that CBCT data, and that's going to, of course, be sent to Suresmile. So the algorithms that determine how we can move teeth in a healthy adult now is incorporating 3D scanning technology, whereas some of the competitors, Invisalign for one, is just using a pan. And, I'm preaching to the choir here when talking about how limited 2D technology can be and how limiting the information is. So that is one of the big differences, is it's going to increase our predictability, our accuracy. For someone like you who is a proficient implantologist, if you're trying to create some space, some proximal space for an implant, as is the case you discussed, or even something in the posterior where you're uprighting a mesially tilted molar, you now can incorporate that root torque in there. So the end result becomes more predictable. You understand how much more time might be needed, whether adjunctive expedient treatments like Propel or vibrating device would be utilized for that. So yeah, obviously it's one of the aspects of Suresmile where it's addressing a limitation of Invisalign for sure.
Yep. Now, quick question on that. You mentioned the Propel or the vibration devices. Can you just give the listeners an outline as to what those devices are and how you've used them? I know a lot of people aren't familiar with it and what kind of success you're getting. And there's also, and again, I have limited knowledge on these devices, but, there's also where, I have an orthodontist, a general dentist that does a ton of ortho that comes in, and I've talked to a couple of orthodontists that do also where they'll go in and perforate the bone to also create the cellular turnover that helps to, especially on a buttress bone case or a dense bone case. Tell us about Propel. Tell us about the technologies and how they help you.
So Propel is exactly what you described. There's two components to it. It's a company that makes a device called the V Pro, which is essentially just a vibrating mouthpiece, which the Hertz is intended to increase osteoblast and osteoclast activity. Whether the science is firm on that, I guess the jury is still out, depending on who you talk to. It still is a little bit controversial, but there's no doubt that it increases aligner fit. And the speed and accuracy with which we can move teeth is, of course, incumbent on that plastic to tooth interface. The second component to it is the micro-osseous perforation, basically, or MOPS is the term that they use for it. So with traditional Propel, they're using what looks like a corkscrew and penetrating through the gingiva and just penetrating into the cortical bone, which obviously increases that inflammatory sequence and then causes faster bone turnover, et cetera, which leads to faster tooth movement. We're modifying that slightly, and we're using an erbium laser for it. Similar process, but obviously the post-operative healing when we're utilizing a 2740 nanometer wavelength is a bit different than using a corkscrew slow speed. So less post-operative discomfort, and it's been working very, very effectively for us. As you know, the limiting factor on the length of time for orthodontic treatment is the slowest denominator. The slowest moving tooth will dictate how long that treatment is. Yep. So what we're doing is we are concentrating that laser acceleration or laser Propel, we call it laser acupuncture, on those teeth that would require the most movement or the most complexity. And you're correct. The greater the bone density, the more complicated it certainly is. So Mike, I know you're doing a fair bit of ortho, delving more and more into Suresmile. Are you using the ortho software on your Primescan?
Yeah, so now that the ortho software has gone into the 2.0, it was a massive jump up from the original ortho software. So it's a bit more of a workhorse now in our clinic. What I find now, when you do it in the Ortho 2.0 software, it'll actually give you all of your orthodontic analysis measurements. So it'll give you angle classifications, Bolton index, overbite, overjet, your transverse distances, the Nance. It'll also do a symmetry, to midline calculation. So it's very helpful information for ortho planning. And obviously you can print that off. You can put it in their chart. It makes your charting a bit more efficient, and your records are better from a medical legal standpoint, from your association standpoint, and then I also think you can use it for insurance as well.
Mm-hmm. Yeah, there's no doubt the treatment planning and the diagnostic records on that are vastly superior to any other system that I've seen. So, as you probably know, you're big into 3D printing. There's also the capability of designing bases. You can save virtual models. You can mount them. They can be emailed. They can be printed. And, one thing that I really like about the software is you automatically have the patient's name printed on there. So if you're doing multiple prints, you're not getting any of those models confused. And it's really easy for the team to navigate and to keep that all organized. But the treatment simulation software is quite impressive as well. And, one of the things that you're quite proficient at is your implant planning workflow, where you are not only treatment planning an implant, but simultaneously utilizing the implant planning software, Simplanter or Galaxis. You're actually showing the patient where the implant is going while you're planning it. And that's one really cool thing about this ortho aspect is you can scan a patient, go through their occlusogram, show the heavy contact points, explain why they're getting recession in this area, and if that tooth hits more heavily, why it'll only get worse. You hit simulation, now you've got the end result where you can show them what that would look like. So I figured that would be right up your alley, and you can do it right at the consult appointment.
Yeah, that's great. Now, let me just add to that a bit. Because I do think that simulation is huge. And relating it to the digital implant case presentation concept that we've talked about on other podcasts, my big thing about digital technology in my office is about the presentation. The point of our technology is to show people what we want to do and getting them to be excited about it and for them to accept the treatment. But it's also and for me, obviously, it's the predictability. It's to know where you're headed. Now, so if we break this down for people that are getting into aligners or digital technology, when we have a new patient that walks in the door, this new patient comes into your clinic, what we typically will do is just scan the arches in the regular Cerec software, and we'll get a set of digital models from there. And what we can do is use the software because it'll show the occlusion very accurately. We've talked about that with our digital impressions that the occlusion is very accurate. So we can look at and do an analysis on a patient's bite. Also with those models in front of the patient, they can look to see and they go, oh, are those my teeth? And then they can see, yeah, there's some crowding. There's some issues there. There's one tooth shorter than another, or they don't realize it. And as you're just spinning those models in front of the patient, part of that is like co-discovery. Mm-hmm. So just like using an intraoral camera, the patients are seeing what you're seeing. Now, if the patient starts to ask, oh, I didn't realize, I had braces before, I didn't realize my teeth were that crowded. Well, we can just right there take those models. And again, we always in our new patient exam are taking these models for records, but we can take that and import it into the Cerec 2.0 ortho software. So we can put it right into the ortho software and we can do the simulation. So if a patient sees their models and goes, they didn't come in for anything to do with cosmetics or Invisalign, but we say, they look at it and they ask us, oh, I didn't realize that one tooth was crowded or crooked or that. Now all of a sudden we're able to fire it into the Cerec ortho software. Yes, we can get all the segmenting, all the measurements, and then we can run the simulation. But the patient sees that technology in front of them about how detailed we're going into their teeth alignment. And then we do a simulation in front of them instantly. And for a lot of patients, they didn't come in for that. But now they're interested in aligners. Now they're interested, they're like, I really don't want to go through veneers, but you're saying that we can correct these with aligners. So I just want you guys to understand that that's how my workflow and getting patients interested in this works. and it's all done with the patient in the chair. Now, if somebody's coming in for a liner consult, for a specific, they just, they saw an ad, or they saw a little billboard or something that said, you guys do Invisalign, or you guys do Suresmile, or you do a liner therapy, whatever they come in for, we can pull up that Cerec software, put their case, scan them right into that, and then we're able to do to show them in that same mode where we do the consult virtually with them, where they're seeing us planning their case in front of them and seeing that workflow. So I hope that makes sense to everybody, how we use that to treatment present. The days where we have patients come in and we take a set of models and it's like voodoo, we say we're going to send them to somebody, then they're going to come back with wax on them, and they're, that's all gone. It's doing it in front of the patient real time, because they came in for a reason. They want to see it. If a guy goes into BMW dealership and you tell him, we've got this really cool car, but you can't see it, they're going to go somewhere else, right?
Yeah, that's a good point, because obviously, and we're utilizing our system in a similar aspect. Not only is it a diagnostic record-taking device where you now have an accurate set of models, baseline digital impressions, but it's that co-discovery component where you're now, of course, explaining to the patients what you're seeing. And even further to that, Mike, for even an experienced dentist like you, it's a great treatment planning tool, because you're seeing what the bite pressure points are with OraCheck software coming to Canada, already released in the States. We now can, of course, compare with future scans to see if attrition, abrasion, or gum recession is getting worse. So I would agree with you. It's a simplistic aspect, and basically it's a BMW on the showroom floor. So and then one of the things that I'll just quickly mention is, where do we go from there? So obviously you have this case presentation, whether it's a patient who's come in specifically for clear aligner therapy, or one that you've mentioned that they may have a malocclusion that would benefit from some orthodontic treatment. Where do we go from there? So you already have that scan, of course, in your Primescan. You can import that directly into Suresmile via the Primescan portal. And now we have the option to go in a few different directions. And this is one thing that I really like about Suresmile, the flexibility for it. Mina Barsu, my friend out of Chicago, discusses this a lot in his presentations and lectures. So you can do full service ortho, where you have an orthodontist and a technician, which is a bit different than some of the other competitors out there. They work on your plan, and they're going to send you plan 1, which is essentially an end result based on all of your CBCT, your optical scans, and your clinical preferences and your prescription that you provide. So if you proceed with that, you're going to get back a set of aligners, and that's it. Patient comes in, you deliver the aligners, and that's essentially it. For guys like you and I, Mike, who have 3D printers, we can also have a technician and an orthodontist create that plan, and then we can export that plan as an STL, where we print our own models, each sequence, and then utilizing a suck down device, we're able to create our in-office aligners, polish them and trim them. The benefit to that is there's a significant cost saving aspect for the patient on that. And of course, cost is a big barrier to ortho treatment. The last aspect is you can also just have Suresmile just send you the model, so you don't have to go through that printing process. And then you're able to create the suck down aligner still at a significant cost saving measure. So you can do it yourself, or you plan the case, print everything, suck down the aligners and deliver to the patient. That's an insignificant cost at that point, all the way to the full service aspect where basically you just get the aligners after you've approved the case. So those are the options. And
so just I'll fire in here just so everybody knows out there that what Vish talked about there, that's brand new. The last workflow there, the 3D printed model. So Suresmile will now send out the 3D printed model. So it's super cool. So if you're like, again, typically in my case, we might do where we do the 3D printing for like up to 5 or even some cases up to 10, we'll do in-house. But now let's say you had a case that you wanted to do 10 aligners and you want them to print your models for you. It does save you that time, and
Yeah.
and the cost is really reasonable. So now you get all the models come to you. But the cool thing is you can also order the models, just the models you want. So you don't have to order all of the models.
Course, yeah.
So it's pretty neat because what you can do, so you can think about it. What I love about Suresmile is for guys like myself who overthink things, is that you can do some pretty interesting workflows. For example, let's say you have a patient you're not sure if you're going to need to use Propel system or if they're going to track. You can order just the first few sets, right? Just order the first few sets of models, print those, and then work on those 3 sets and make sure that you're actually getting the case moving forward before you order the rest of them, because at that point you can decide to change it, start over. So it's really neat, and that's all brand new. So so just so everybody understands, previously you were just getting STL files and you had to print your own models, which of course you can always 3D print whichever set of models you want or reprint them. But now you can also order those models, and by the same token, you can also order the models in stages. You don't have to order them all at once. So it's very, very user friendly to cover, I think, more cases. Now, and I guess the other thing that was new is that you don't have a fee now to just do that initial workup. Mm-hmm. So that way you can do workups on patients, get them to see the video of the workup, the before and after, without having that financial commitment, and you can work that into your systems in your office. Now, is there any other new updates that have come out?
That essentially covers that component there. Obviously, the ortho software, there's been improvements with that. The flexibility that Suresmile currently has with the different systems, you basically cover it. The newest one is the one you just outlined. And then the other aspect, at least in Canadian dollars, the initial treatment planning process was $300, which I think was a bit of a barrier.
Yeah.
And you know that if you present something appropriately to an interested party, the conversion rate's high. But as soon as you put a dollar figure on that beforehand, that, at least in my practice and with my communication style, can be a bit of a barrier. So those are some of the improvements, which is great. So Mike, how are you guys making the trays in your office?
So we have the Drufamat system. So when we have the 3D models, whether we get them from Suresmile or we 3D print them, we'll use the Drufamat with the Essex trays to do the suck downs, and then we'll use a tray cutter to cut the trays and then polishing them. Now, from a 3D printer perspective, we have the Moon Ray. Mm-hmm. I do know that the Moon Ray, the Sprint Ray company, has come out with a new unit, and the reviews on it have been quite good. I know with my Moon Ray, it was took a little while to get it all dialed in. You've had great success, I know, on your side, but the Moon Ray, the new Sprint Ray Pro, I think it's called, the reviews have been quite strong. And then we have a second printer as a backup. So if we ever have a printer that goes down, we have an Anycubic Proton one, which is actually you can get off of Amazon. It's not as big of a platform. You can't print as many models, but it is a good little printer. And we've picked up the Anycubic cleaning and curing unit, again, on Amazon. Very, very good pricing, for what you're getting. So when it has a little unit for you to ultrasonic clean the model, and then it has a little curing platform. So that has worked really well for us, for our models. Now, how about you, Vish? Similar stuff?
So we've got the Form 2 and Form 3, and they've been effective for us. They've been reliable. There's some limitations with them, of course, but for the price point, we've been quite happy. I'm not familiar with the newest one that you've picked up. So, at the end of this, I'm going to go take a peek, and you can give me the nuts and bolts of it. And same thing with you, we're using the Drufamat.
Yeah, nice. Yeah. Now, when you're running your courses, what are the key things that dentists are having difficulty with implementing Suresmile?
Well, it's a twofold answer to that, Mike. The first aspect is for people like you and I who've been accustomed to Align Tech and Invisalign for so many years, the sequence of how you get aligners delivered is a little bit different. So with Invisalign, I'm going to scan you. I'm going to submit it under the parameters of my normal prescription. They're going to send me back immediately a ClinCheck within a few days after we've uploaded all the records. and I will either make some modifications directly on with ClinCheck Pro, or I will communicate with the technician to let them know what I want changed. And that's just referred to as the ClinCheck. With Suresmile, keep in mind it's a much more complex bit of software. There's a lot of other applications, including ortho diagnosis, record taking, indirect bonding. So initially what we're going to get is a therapeutic model. Essentially what we're just going to do is scan you, and we're just going to get your digital model placed into that. Then the next aspect is the end result, or the plan. So it doesn't actually show us the steps to get from point A to point Z. It just shows us the beginning result and the end result. And then after that, we're going to have to go through the planning process where we actually have the staged aligners. And so you have to approve each individual step and then order the aligners towards the end. It's not complex to figure that out, but when you're accustomed to just working in one median, as in AlignTech's software, that can be a bit confusing initially. So I would say that's probably the biggest challenge. The second aspect to that answer is for those dentists who maybe are not as experienced with clear aligner therapy, the question is always, how do we present it? How do we discuss it? How do we bring that up? Now, obviously, that's a much deeper rabbit hole to get into. You have to incorporate your hygienists, as teaching all the sleep courses. Having your team bring up concerns is instrumental to making our patients, or enabling our patients to understand what their concerns are. But also just the technology that we have. Now that we have Primescan technology, we can show, diagnose, co-discovery, all of those concerns simultaneously, which I think makes the conversation with patients a little bit easier. So kind of those things, just the software differentials. And then for those new users, how do you actually talk about orthodontics and bring it up?
Yeah, well, that's great information. I do find the software obviously is very comprehensive. And so I did find myself the learning curve was a bit longer, but I do like the support. They'll get on, log into your computer with you at the Suresmile support, and they'll just really walk you through it. They can also set up coming in office with a local tech, and they can help you work through it. So I found the support has been great. So whatever when you're picking up the new techniques and the new learning curve there, Suresmile is definitely there to help you out. Is there any other tips or tricks in your course that you outline for those users that are getting into Suresmile?
It's an intuitive software. Obviously, it takes a little bit of time to get accustomed to all the guide tools, the displays, the various views that you have, the comparisons between your different views. But one thing that I find very, very helpful is we can overlay the photographic images of the patient's smile over top of their digital scan. So you can actually see what the patient's smile line will be. And as you're moving teeth, in the case of the aesthetic case that you were just discussing, you can actually show how the teeth will fit within that smile. And that's really powerful software, especially when you're doing pre-orthodontic aesthetic cases that can be really beneficial from that perspective. That's kind of the main aspect. You've gotten into the tools and the display in a little bit of detail. It can be a bit overwhelming for sure. So simplify initially would be the one suggestion, and then just utilize a few of the other additional tools, the Smile One and CBCT software superimposition being, I think, the two big ones.
Yeah, and I do know one thing that I found was kind of neat is that you get a case back, and so I'll be honest, like my comfort level has been having them plan it, okay, and then when it comes back, I will use the manual tools to do some light shifting. Mm-hmm. So I'll be like, you know what, I want to see that one just a little bit. Whereas when I used to use Invisalign, it would be, okay, send it back. Then you'd have to wait, might be a day or two. Yeah. And then it would come back, you make your changes. And then you're like, okay, I don't like that. And you're sending. So I find like a lot of times I look at it and I just want to do a little tweak. And so that's what I do the manual part for it. For myself is I'll use the manual tools just to do those tiny little tweaks. And then I'll hit approve, right?
Yeah.
Another trick that I've heard of people doing, and I don't know if you've seen this, but they'll do the workup And then, I guess it's a case by case scenario depending on what you're doing with the aligners, but especially in a case where there's a real high cosmetic patient, let's say you're bringing out the buccal profile of the teeth. I've seen where people have 3D printed the last set of models, and then made like an integrity overlay, and then put that in the patient's mouth, and then they get to see the final result with integrity in their mouth, kind of like we've done with veneer cases, almost like a virtual cosmetic wax up. So I'm not sure if the software could be technically used for that. What's your thought? Do you do anything cosmetic wax up virtually, or your Primescan, or anything on that line?
Yeah, so Mike, it's a good question, obviously. Smile trials are immensely powerful in getting case acceptance and really enabling a patient to see what the end result is. It's something that us practitioners, we can, of course, envision that because we do it routinely. But for someone who's going through for the first time, it's hard to visualize that end result. So it's good to have that information. I do on occasion utilize the Primescan for a digital smile trial wax up, but it may be a bit different than what most people are doing. Mike Skramstad talks about utilizing the in-lab software that you have extensively to this. For those of us who don't have that software, what I will do is if a patient needs an additive procedure, if their incisal length is insufficient, if they have lingually tilted teeth like you and I have just discussed, we'll actually just scan the teeth initially, and utilizing that digital model, let's say, for example, you're redoing the front 4 teeth or you're adding some length to the front 4 teeth, we will just essentially plan it as a lateral incisor, central lateral, and we'll marginate just the incisal edge or just onto the facial and lingual aspect, and allow the proposals for the computer to give us a proposal for adequate length. Now, utilizing the distance tools, we can determine the, obviously, length to width ratio. The only challenge with this, of course, is that the midlines have to be on in this pre-planning phase. And then from there, what we'll do is I'll actually just mill this out as a 3 or sometimes 4 unit bridge in Telio, which will just snap onto the patient's teeth. We'll put it on with some flowable, unbonded, cure that, and it gives them a really good idea of what the smile trial will look like. Now, we're not doing this orthodontically, it's for restorative. Now, at that point, if they like the result, I know that the Cerec software is going to be able to give me a really good proposal, so we'll go ahead and prep and do it that way. Is that the recommended approach? No. So the more effective method, Mike, would be to use Cerec in-lab software, which is what you currently have, and to be able to seamlessly export the Cerec design to a printer. So obviously we're milling, which is fine, but the ability to print that would be more seamless and a little easier. And obviously as the technology advances and progresses, Dentsply Sirona will come up with something where we can seamlessly print from Cerec software. But that is one workflow we utilize, and it's a great option for incorporating a smile trial.
Nice. And yeah, so again, placing the margin, you're basically just placing the margin like a snow cap type preparation, 3 or 4 millimeters from the incisal edge, so you can kind of blend it into the teeth. And I think that's a really, really cool trick, and then mill that out. And I think it's really neat that you can do that for, let's say, for a case where a person has congenitally like shortened, like peg laterals or something. It'd be real nice. You could just put them in, even temporarily cement them, and they could go home with it and try it out. It's pretty cool. Pretty cool to be able to do that. Now, let's talk about getting this aligner therapy ramped up in your clinic. We've talked about existing clients and how doing the simulation, or new patients doing the simulation helps. And that can be a quick way to get your patients informed about what you do and understand. I really feel that that's same with implants, is doing the co-discovery really helps patients understand what you're doing. And now as far as marketing and build up in your clinic, what process have you guys done?
So we're really concentrating obviously on internal existing patients. You and I both know the benefits of orthodontics from a health-based perspective. So of course, we're all scanning new patients with the Primescan when they come in. It's great for co-discovery. Toggling those images is immensely powerful and has a significant wow factor. But what we're also doing, Mike, is we're doing diagnostic reevaluations or evaluations, we call that, on existing patients. And it's just an updating of our records, whether it's CBCT, SLR, or iPhone photography. And we're now, of course, incorporating the Primescan into that. And as we scan that, I'm going through the occlusogram to show them where their heavy points are. As you mentioned earlier, a patient might be able to see wear patterns or teeth that they didn't know what they look like in the posterior aspect, even with previous SLR photography. So we're incorporating that, and now, of course, we can just simply export that into ortho software and do a really quick simulation to show them what a new, healthier bite would look like. Maybe it alleviates their lower anterior crowding, and if that scan is taken before hygiene, for example, you can see the calculus or tartar buildup, so patients start asking questions about that. So for me, that's the main aspect. I know this is a bit of a Primescan plug, but using that as a digital impression system to record their existing condition, present it to them, and we're also using it as a diagnostic tool where you and I or other dentists are able to determine what the likelihood of wear continuing will be if their bite is imbalanced. So that's what we're doing. Obviously, we have the hygienists discussing these diagnostic evaluations as opposed to just having a recall. We'll book them back for typically 60 minutes with the dentist. And we can really talk about the benefits. So that's the marketing that we're doing internally right now, which really expands on exactly what you were just talking about.
Yeah. Anything external that you guys have done?
Nothing successfully. And, we recently met with a marketing guru, and they were mentioning that radio is still a very effective medium. It's a strange concept to me because, I just view it as an antiquated advertising mechanism, but apparently it's effective. For us, with the multiple practices downtown that we have, though, Mike, I think that we are really just concentrating on our existing patient base and trying to take care of them and informing them as to what services we can offer. What about you guys?
Yeah, I think, it's important, like you said, the internal. I do really feel that it is the most critical thing with your patients and even in the external realm is to let patients know what you're doing. It doesn't have to be really slick marketing or anything like that. It just really has to let people know that you're offering services that they normally wouldn't expect. So that you do Suresmile, that you do aligner therapy, that you do Invisalign, that you do cosmetics, that you do IV sedation if you're doing IV sedation, that you do Botox. People need to understand that you're doing those procedures. So I find, like in our office, we have like a TV that plays up at the front that plays like a PowerPoint of showing different treatments that we're doing that are coming up. We also have like banners that we put up at the front so people can see when they go by the office, and so we'll change those out. So it's really about letting your patients know what you're doing, and patients that are going to be going past your clinic what you're doing, new patients that are coming or potential new patients. It's really informing your patients of what you're doing in-house. And then externally, we haven't done a ton either, but I do think, putting out on Instagram or doing some of the Instagram Google ads, I think is a cool way. And I think we're going to investigate doing that a little bit to build that as another way to get it out there. But again, start with internal referrals. Let people know what you're doing. I think those are key things.
Yeah, I think that's the easy approach as well. Like obviously search engine optimization, Instagram, other social media medians are going to be important and effective for growing a patient base. And we are all in the business of dentistry. But for someone who's just looking to get into this, you have an existing patient base. There is certainly need there. And our job as practitioners is to present options, educate our patients, let them know what their pre-existing conditions are and what the damaging results of those existing conditions may be in the future, educate them, utilize the technology that we have to help facilitate that education. And then you have an informed patient that is going to make a decision, and whatever that decision is, we're now comfortable supporting that. That to me is just the easiest marketing approach. You can delve into a lot of other aspects, but it's not my area of expertise, maybe a little bit more of your area of expertise. But I do have a gorilla suit at home. You're really good with spinning a sign, so maybe we should just do some corner of the street marketing.
I think that's the way to go. I think we're on to something there. So if anybody's out there as a big marketing guru that wants to get involved with the Gorilla Sign launch here, the IPO will be coming. Feel free to give us a shout. Thanks, everybody. I really appreciate you giving us an update, Vishal, on what's happening in Suresmile. I do know it's constantly updating, so we will have to do some more of these podcasts just to bring people up to speed on what the new things are that are coming out in the software. The market is just expanding so much and it's exciting to be a part of it. And a quick follow up. When's your next course?
So I actually have with Dentsply Sirona a presentation virtual of course on digital impressions and exactly what you and I talk about, how we have incorporated Primescan as a digital impression system within our office. There's no impression material at either of the offices that I work at, no alginate, no PVS. We may have some putty, but it probably expired in 2015. So we're utilizing that, and I'm discussing how effective it's been for us with all of the things that you just talked about. And Mike, I know that besides our digital marketing expertise, maybe we need to do a podcast called DMD, Digital Marketing Dentist. But you've got a course coming up in 2 weeks on CBCT. Tell us a little bit about that.
Yeah, so in that course, it's a user course, so it's people that have purchased any of the Dentsply Sirona cone beam machines. It's a training course. Goes through a lot of the digital workflows and educates them on using their equipment. Full day course, plus there's an online portion that they complete beforehand. And so if you do have a CBCT from Dentsply Sirona and you are wanting to get updated, or you have recently purchased one, just reach out to your rep and they'll get you squared away to get into one of those, the next course or one of the upcoming courses. And then we'll keep you guys informed on our Instagram at Digital Workflow Dentistry for anything else that we've got coming up. I really appreciate everybody for tuning in, and please do subscribe. And all of our links are on the bio in our at Digital Workflow Dentistry Instagram. Go to our Digital Workflow Dentist website for, again, information, research information, articles. And again, all I can say is stay well, and with this next level of lockdown, and everybody please take care.
Thank you. Take care.